Hello everyone, friends. Today we're going to talk about 5 myths when it comes to running a dental blog. If you think that blogging isn't for you, that patients won't watch you, that you don't have time, that you're not media savvy, and so on, stop. Today we'll break down the 5 main myths that prevent doctors from going online, building a strong personal brand, and turning their blog into a powerful tool for their work. I've been through this journey myself, from being afraid of the camera to running a blog that brings me a new audience, new clients, and monetization every day. I know for sure that you can do better than you think. Myth number 1. Patients aren't interested in what I do during appointments. This is the most common myth, like nobody cares how I treat cavities. What interests patients isn't how you do it, but why it's you specifically. Your work may be routine for you, but for the patient, it's a mysterious, foggy territory. Show them how you think, what you consider important in treatment, what technologies you use, and what you pay attention to. Of course, you don't need to overwhelm the patient or get into medical jargon, but it's enough to explain things in simple terms. Patients love to see a bit of behind the scenes, preparation for the appointment, some backstage moments, sterilization, and care. They make choices based on emotions, and emotions arise when there is trust. For example, record a Reels video where you talk about what you do before seeing a patient, how you prepare, or how and with what a dentist with 15 years of experience brushes their teeth. This will get views, you'll see. Myth number 2, I don't have time for a blog. This is probably my favorite one. Question, do you want to have more time in the future, or will you always not have it? One Reels video takes 10 minutes a day, right? One post takes 15 minutes. A single blog can bring you 3 or 4 new patients a month or even per day. The problem isn't time. The problem is actually about priorities. You brush your teeth in the morning and at night, right? Because you know that otherwise things will be bad. It's the same with blogging. Your digital footprint equals your future patients. 15 minutes for a Reels video equals 1 patient, which equals however many thousand rubles from an appointment. And more importantly, you helped that one person. Myth number 3. I don't know how to film or speak on camera. No one knew how at first, not even the top bloggers. I used to re-record my first videos several times. I was shy, mumbled a lot. Even now, I probably still mumble. Then I realized something very important. The camera isn't a stage, it's a mirror. Speak as if you're talking to your friend or to your patient during an appointment. The simpler, the better. Don't know how to film? A phone, natural daylight, and a basic tripod, or even just a stack of books for 500 rubles is more than enough to get started. Your goal is to be clear and genuine. Myth number 4. A blog is something unserious. It doesn't add to a doctor's image and actually harms their reputation. In reality, a blog isn't just entertainment. It's a real tool for influence and building trust. I think many have noticed how entertainment content has transformed. People are gradually losing interest in it. All this low-intelligence content is slowly fading away. Now, on the contrary, there's a trend towards solid experts and professionals in their field with real experience. So, doctors, it's your time to shine. What's wrong with creating useful content when you have the knowledge and experience in what you're talking about, and you're bringing real value to people by answering important questions? Is that what you're embarrassed about, or do you think it could somehow negatively affect your reputation? Let other bloggers who create harmful content be ashamed, not doctors. You have absolutely nothing to be embarrassed about. Moreover, it's your mission to help as many people as possible. You're not clowns, you're experts. And nowadays, not having a blog doesn't make a doctor look good because it shows egocentrism, selfishness, and living only for oneself. And when you think that a couple of people will say to you, why are you even doing this? What, are you a blogger now? Calm down, you're a doctor. Think about how many thousands of people you'll deprive of valuable information if you don't go for it. And the 5th myth? This isn't for me, I'm not a media person, I'm modest, and so on. I've probably heard this hundreds of times, right? I'm not the right fit, my voice isn't right, I have some kind of accent, my appearance is this or that, I don't know how to act in front of the camera. And do you know what I say to questions like that? The patient doesn't care what you look like. What matters to them is whether you explain things clearly and whether they trust you. And that's a skill, and any skill can be developed. And a blog is just like a gym, right? The first 2 weeks are tough, then come the enjoyment and the results. You didn't get the perfect veneer prep right on your first try either. If only you knew how many top dentists started out with the same doubts. Now they have lines of patients waiting, appointments booked months in advance, their own clinics, and confidence in their future. They all started with simple videos and made the most basic mistakes. And you can do the same. You don't need to wait until everything is perfect. You need to start and work your way to perfection. If you're interested, in the next videos, I'll tell you how I went from being a dental assistant to building a stable and solid business from my blog. Subscribe so you don't miss the new episodes. And remember, your blog is your most underrated asset. See you soon.